All right, I think we'll go ahead and get started. Welcome everyone to Brain Injury Awareness Day on Capitol Hill Congressional Briefing virtually. We appreciate you all taking some time out of your schedules to be with us today. My name is Becky Wolfkiel and I am the Executive Director of NASHA, the National Association of State Head Injury Administrators. And I am joined today by leadership from the Brain Injury Association of America and the United States Brain Injury Alliance to support the Congressional Brain Injury Task Force's efforts to host Brain Injury Awareness Day on Capitol Hill. As you may know, each year we come together in March to celebrate Brain Injury Awareness Month, and historically in person on Capitol Hill, met with our congressional leaders and advocated for more resources and policies that benefit individuals living with brain injuries. This year, we have obviously had to pivot, as in last year, and have been hosting events virtually. And I think to great success. I'm really proud of the work that the collective community has done to be able to create even more opportunities for people across the country to share their stories and their experiences with members of Congress. Last year, whenever we embarked upon our first virtual Brain Injury Awareness Day briefing, it was clear that while we were able to reach many, many more people, the audience really was filled with advocates across the country rather than in person, when the audience was more focused on congressional staff and members of Congress themselves. And so the Brain Injury Task Force and the organizations that support its work thought that maybe this year it would be exciting to bring members of Congress and their perspectives to the advocates. So today, we are really excited to be able to share with you some videos and some live commentary from members of Congress, and as well as our friends from CDC, Dr. Matt Briding. You'll hear today from Carrie Swope and Matthew Douglin, who staff the Congressional Brain Injury Task Force. Their bosses, Congressman Bill Pascrell and Congressman Don Bacon, have been the co-chairs for several years. And we wanted to give them an opportunity to explain to everybody how the task force operates, the importance of the task force, and give some tips for how we as a community can better engage with members of Congress, share our stories, and transform those members into advocates as well. So as you know, each year we typically have a fair and a briefing and a reception. And this year we have been able to keep the briefing piece of the agenda, again, really highlighting the task force and their members and congressional advocates. But we've also had a number of congressional virtual visits as well. And again, the organizations came together and have been meeting with folks across the country to share your stories. And for those of you that have been participating in those advocacy visits, thank you. I think you'll hear today from members of Congress about how important those visits are and what they result in. Sometimes we meet in March and then we go back to doing what we do, really important work every day, and might forget that those members did hear our stories, those staff did hear our stories, and they took them and they made policies as a response. And so hopefully today you'll get to see a little bit more of that as well. I want to thank my co-moderators and supporters for the day as well. Carrie Collins with the Brain Injury Association of Arizona and Public Policy Chair of the United States Brain Injury Alliance, and Susan Connors, President and CEO of the Brain Injury Association of America. You'll be hearing from both of those individuals throughout the day as well. So first, we are going to kick off with some information and some better understanding from our Congressional Brain Injury Task Force co-chair staff. So Carrie Swope works for Congressman Bill Pascrell, and Matthew Douglin works for Congressman Don Bacon. They are our true champions on Capitol Hill and are working for individuals with brain injury every day as part of their job. So I am pleased to ask Carrie and Matthew to turn their cameras on and take it from here.
Thank you so much, Becky. And thank you all for logging on today. We're really excited to give you an update from the Congressional Brain Injury Task Force. My name is Carrie Swope. I am Congressman Bill Pascrell's Health Policy Advisor. I've been with him for about 3 years, and I've been on the Hill doing health policy for 9 years. And I'd like Matthew to introduce himself also before we get going.
Thank you, Carrie. As she said, I'm Matthew Douglin. I'm Congressman Bacon's health legislative assistant. I've been with him for about a year now, and I will turn it back over to Carrie.
Thanks, Matthew. So I want to quickly provide a recap of federal funding for traumatic brain injury for fiscal year 22, which is one of the main things that we work on at the beginning of the year in the task force. And this, what I'm about to speak about is our funding levels that were included in the omnibus funding bill that was passed last week and signed into law by the president yesterday. So within the Department of Health and Human Services, we secured $8.75 million for traumatic brain injury within the Centers for Disease Control and Prevention, including a $2 million set aside for concussion surveillance. This is an increase of $2 million from fiscal year 21, and this funding will help CDC continue its crucial work on a national surveillance system to accurately determine the incidence of concussion. You'll hear more about that project later from the CDC. The task force also secured $15.321 million for Administration on Community Living TBI state grant program, which is an increase of $4 million from fiscal year 21. And this program, as you all know, supports state efforts to address the needs of people with brain injury and their families, to expand and improve services to underserved and unserved population, including children and youth, veterans and returning troops, and individuals with co-occurring conditions. We also secured funding at the National Institute on Disability, Independent Living and Rehabilitation Research to increase its model systems. We don't yet know how that will be broken down yet, but we will keep you all posted. However, the bill did include a $100,000 increase for the Traumatic Brain Injury Model Systems National Data and Statistical Center. And just one tidbit from the Department of Defense funding, the congressionally directed medical research program at the Department of Defense, we secured $170 million for peer-reviewed traumatic brain injury and psychological health research, which is an increase also. While we've made really great strides, there's still a lot that we don't learn about TBIs, including through military service, particularly the impact of blast injury. And so just to wrap up appropriations, as many of you are meeting with your members of Congress today to discuss federal TBI funding moving forward, our requests for fiscal year 23 are in line with what we received for fiscal year 22. And now I'll hand it back over to Matthew with Congressman Bacon to talk about some of our legislation.
Thank you, Carrie. Yes, I'll be providing an overview of the two bills that the task force is currently working on. The first one is the Traumatic Brain Injury and Post-Traumatic Stress Disorder Law Enforcement Training Act. Despite the prevalence of TBI and PTSD, the majority of the public cannot recognize or identify the symptoms and struggle interacting with individuals suffering from these conditions. And this is true also for law enforcement and first responders. In response to that, Representatives Pascrell, Bacon, and Rutherford introduced this bill. which would direct the Department of Justice through the Bureau of Justice Assistance to solicit the best practices and develop crisis intervention training tools for law enforcement and first responders that provides information on the conditions and symptoms of traumatic brain injury, acquired brain injury, and post-traumatic stress disorder, and techniques to improve interactions with individuals displaying these symptoms. It would also require that this training be made available as part of the Police Mental Health Collaboration Toolkit, which is a no-cost online training tool that provides resources for law enforcement agencies partnering with mental health providers. They would also authorize $4 million per fiscal year for the Justice and Mental Health Collaboration Program to fund grants to develop and implement this training. And finally, would require a CDC study for law enforcement and first responders who may have suffered a TBI. The other bill that the task force is focusing on right now is the BRAIN Act, which is the Bring Regulatory Advances into Neuroscience Act of 2021. Representatives Blumenauer, Bacon, and Pascrell introduced this act last year to establish a neuroscience center of excellence at the FDA. The 21st Century Cures Act, which was enacted in 2016, created the Brain Research Through Advancing Innovative Neurotechnologies initiative, which has led to groundbreaking advances in our understanding of the brain. Despite these scientific advances, patients continue to lack access to enough safe and effective treatments for the brain and for central nervous system conditions. A neuroscience center of excellence would create opportunities for innovation in the development and regulation of treatments for the brain and for brain disorders, giving patients access to more effective treatment options. Those are the two bills that we are currently focusing on, and I will turn it back over.
Thanks, Matthew. Just to close our first remarks, we continue to gain members of the task force. Right now we have 85 members. We would like to thank all of you, our advocates, for helping to gain support for federal funding for TBI and for helping us secure more task force members. Hopefully next year we will be able to be together in person for BIA Day. I'll hand it back over to Becky and I think that she might be asking us some questions.
Yes, thanks, Carrie. So we have 85 members of the task force now, and I think many advocates want to know if their member is a member of the task force, and if not, what they can do about that. So could you provide, is there a list somewhere? How could they find out if their member is on the task force?
Yes, absolutely. We have a list of current members. And I know all of our partner organizations have that list. If they don't, they can absolutely get one from me. I'm constantly updating it because we are getting new members all the time. But I think the best way to advocate for getting your member on board is to call their offices and ask their member to join the task force. And we can send around our dear colleague that invites members to join. You know, we have a lot of members who are retiring next Congress, so we will need to get our numbers back up once we lose some folks.
Yes, and I believe that there is a list on the partner organizations' websites as well, where we try to keep it updated. So what advice would you have? You know, I think a lot of our members and advocates, they're used to doing this every March. They come to the Hill, they have their spiel down, they, you know, feel very comfortable talking with elected members, but some don't. And especially with the virtual opportunity, people that weren't able to come to DC before now can have visits with elected folks. So what kind of tips do you have for them? What it makes meaningful and effective advocacy from your perspectives?
I'll start, and then if Matthew has anything to add. I think first of all, don't be nervous. It's just a conversation. We are here to help. And we love, I think, at least from my perspective, telling your personal story, if you're comfortable sharing it, is a great way to connect with staff and with members. I think those are my first two pieces of advice, but I'll let Matthew fill in.
I would definitely second that, especially the personal stories. It always just makes intangible facts really connect more, and especially for those of us who maybe have not had personal interactions with TBI, it really helps to make it sink in and really make the experience far more memorable and easier to act on.
And how can someone identify who their member is? As you mentioned, there's every 2 years, especially in the House, there often are changes. How can they determine who the right person is to reach out to?
Sure. So there's actually a website. I think it's zip.house.gov, where you can plug in your zip code and see who your representative is. You might need the second 4 digits of your zip code if districts are, if you're close to a district line, but you can find out who your member is. And then you can call their office and ask for, their healthcare LA or whoever handles brain injury. Usually it would be their healthcare LA. That's the best way to get in touch, I would say, with your member and with staff.
And what does LA stand for?
I'm so sorry. Legislative assistant.
Okay, great. So you mentioned that there was an increase in the programs that support individuals with brain injury in the FY22 budget bill. Can you provide sort of an overview of the budget process? I think, we hear about the president's budget and there's a budget bill and we have authorizations in the TBI Act. Would you mind sort of breaking it down for us so that we can better follow what's happening?
Sure, I will do my best. So every year the president submits his budget request to Congress. It is not a binding document, it is more of a guideline, but it usually has their budget request for every federal agency. So using that, Congress will begin hearings for appropriations bills. They'll bring in agency heads to hear about the budget, and then they'll start writing the appropriations bills and come up with kind of the top line numbers at the top of agencies, and then more detailed into the weeds numbers, like the CDC TBI program. That's not at the very top. It is more into the details. And then the Appropriations Committee will hold markups. Those markup is just when you vote to advance a bill through a committee. And then those bills will hopefully come to the House floor, and same on the Senate side. And then they will be passed. Usually as a larger bill. I was talking earlier about the omnibus. This year, our appropriations funding came in the form of a larger package that included funding for Ukraine. That does happen often, and ours is very late this year. We're already moving into FY23 territory, but it's important to have a budget every year. And so just briefly, the TBI Act authorizes the funds that we have for our TBI programs, and appropriations actually doles out the funds. So even though a bill might authorize the funding, you then have to have those funds appropriated so that they actually go to the federal agencies and states that conduct those programs. Sorry, that was very long-winded and probably very confusing.
Oh, it is a very complex process. So I think that makes a lot of sense. And so as part of the advocacy visits this week, we are circulating your letter, and are so grateful for your boss's leadership every year. As you're saying, we have to fight for this funding for our program. Can you kind of explain what the letter, why that's so important, and kind of how that plays and fits into the process that you just outlined?
Sure. So once we receive the president's budget request, that is when members individually will start putting together letters for their own priorities. So Congressman Pascrell and Congressman Bacon, our highest priorities are funding for traumatic brain injury. And so we put together a letter that we circulate around to other members of Congress, asking them for their support. We generally get a ton of support. It's great. It's bipartisan always. And then we submit that letter to the Appropriations Committee saying, look at all of the support we have for our TBI programs. Please fund the CDC at X level or ACL at X level. And so those letters, as detailed as they are really helpful to show the Appropriations Committee exactly where we want funding to go and exactly where we need increases. For example, if we say we need an increase to the ACL account for the TBI state grant program so that we can add states so that more states can receive federal TBI state grants. That tells them exactly what we're going to do with the funding, and we'll tell them how many states currently have that funding and how many don't. And so it's important to be specific, which is why those letters end up being pretty long. But that's just kind of a little snapshot of what they're looking for and what we advocate for here.
And Matthew, from an outsider's perspective, it feels as though there are fewer and fewer causes that parties come together and really coalesce around. And we're so fortunate that this is one that has always remained nonpartisan, bipartisan. Can you speak to maybe why that is and why your boss was so excited to be able to partner with Congressman Pascrell as the co-chair of the task force?
Sure thing. As you said, there's fewer and fewer causes that seem to get bipartisan support, but this is definitely one that affects all segments of the population. Doesn't matter right, left, Republican, Democrat, Independent. As for why my boss is very supportive of this, he will speak about later on. He was a general in the Air Force, and so he had firsthand experience seeing how our service members are affected by TBI, and really made this a personal issue for him. And then since he has been in Congress, that experience has only been increased from how you can see it for both service members and for the general populace. And therefore, this has been a passion for him.
That's wonderful. So I know we typically support, I think historically, the task force has been very supportive of funding that helps individuals transition into the community after a brain injury has occurred. I thought, one of the efforts that you talked about, Matthew, that I know Congressman Blumenauer will be talking about a bit when he joins us in just a few minutes, was really exciting because it's more focused on the research side of things and research to practice. And so if you don't mind sort of talking about the process of, we have this neuroscience caucus, and then we have the Congressional Brain Injury Task Force Congressional Caucus. This was the first time that I was aware of that you kind of partnered together to ensure that there were synergistic efforts and that a bill sort of encompassed both. Can you talk about that process and how that works a little bit?
Sure,
I think I'm going to let Carrie do that. Yeah.
Sure. Sure. So, the Neuroscience Caucus and the Congressional Brain Injury Task Force have some considerable overlap when it comes to policy. So we try to work together whenever we can. We actually do. We work together on this bill, on the Neuroscience Center of Excellence bill. We also work together on another appropriations letter for the BRAIN initiative, which Matthew talked about a little bit, which is the Brain Research Through Advancing Innovative Neurotechnologies initiative at the NIH. And we think it's important to partner where we can, especially because we're really on the same team. So we started talking about having a neuroscience center of excellence several months ago, and then the 21st Century Cures Act 2.0 coming up just seemed like a really good place to try to get that language in. And so we're working with the folks who are working on that legislation also. So it's it's a long-term project, but it's definitely a very interactive project where we get to work with other staffers who also care about the brain in different capacity. I don't know if that answers your question at all. It is hard to describe how we go back and forth so much here, but it is fascinating and really good to have other partners in this too.
Well, I think that resonates with everyone on this webinar, because the brain injury community is only effective when when people partner together to serve the community. So at all levels, partnerships are really important. And so mentioning this neuroscience caucus, I think there are, I don't know, over 100 caucuses. Can you sort of explain what's the role of a caucus, and what are the types of activities that you all engage in typically?
Sure. So caucuses are just a group of members with a like-minded interest. So there could be a caucus. There's the Congressional Brain Injury Task Force is one example. Another example is a diabetes caucus, where people are interested in research and treatment in the diabetes community. Of course, there are non-health related caucuses too. I just handle healthcare, so it is difficult for me to think outside of that box. But it's generally a place where we can share ideas, share legislation, and have like-minded conversations.
Great, thank you. Well, I see Congressman Blumenauer joined us. Welcome, Congressman. Thank you so much for joining us today and joining Brain Injury Awareness Day on Capitol Hill. I'm going to just read a very quick bio for you, and then we'd love to hear about your initiatives. We've talked about some of your work with the Neuroscience Caucus a bit, and are excited to hear from you about it. But Congressman Blumenauer is a lifelong resident of Portland, Oregon, and he was first elected to Congress in 1996. He is a member of the House Ways and Means Committee, Subcommittee on Health, and he co-chairs the Neuroscience Caucus with Congresswoman Kathy McMorris Rodgers. The Neuroscience Caucus is really focused on promoting and developing legislation that advances neuroscience research, and the Congressman has also been a staunch champion for ending gun violence and criminal justice reform, amongst other things. So, Congressman, thank you again for joining us, and we look forward to hearing from you today.
Well, thank you, Rebecca. I appreciate the invitation to join with you. This is an area that simply does not get the attention that it needs. Neuroscience and issues that relate to neuroscience, brain injuries are absolutely critical. And it is stunning, the sweep of these challenges. Virtually everybody knows someone who in their family, their friends, their circle suffers from some neurological condition. It is extremely expensive for society, and it touches virtually every family. I'm pleased to join with my friends Congressman Bacon and Congressman Pascrell with their leadership of the Brain Injury Task Force, something that people really don't focus on, but it is affecting, 50 million Americans, and costs the nation probably $1.5 trillion just in this area as well. And despite the toil and substantial investments in research today, treatments for brain conditions are more expensive to develop, they're more likely to fail, and they take much longer to develop. It's clear that the federal government needs to play a much more aggressive and extensive role. That's why I am pleased to have introduced legislation that would establish a center of excellence focused specifically on neurological conditions to play a key role in creating opportunities for innovation in the development and regulation of new treatments. By focusing on the nervous system as a whole, instead of one disease here and another item there, centralize existing activities. A center of excellence would make the FDA more responsive to quickly changing science while keeping patients in the forefront. In this way, we can ensure that the safe and effective treatment are being produced that would provide relief for people who need it the most. The BRAIN Act would also create a working group with representatives from agencies, patient advocates, and experts to advise the Center of Excellence. This type of partnership and oversight will allow for a transparent process to inform the regulation of treatment and cures. We have over 88 organizations, from patient groups to researchers to industry, supporting the bill. It's clear that the scientific community is behind the approach. We need to expand the scope and reach of our activities. We need to make sure that we use every resource at our ability to focus on this critical area of need. I've been involved with neuroscience research here on Capitol Hill, creating the caucus to try and promote more activities. I'm pleased with some of the progress that we've seen, but it's so clear that there is much, much more that needs to be done. And if we only are able to focus the attention from the people whose lives are touched with neuroscience disorders, I'm confident that we will have the momentum, the support, and the follow-through that will enable us to be able to realize the promise of the Neuroscience Center of Excellence and be able to obtain the progress that we so desperately need. I appreciate the opportunity to share with you some of my thoughts and observations. I would hope that all of the participants here would focus on the ability of this legislation to enact the Center of Excellence and what it would mean in a subject that is so important to us all. Thank you. Thank you very, very much.
Thank you, Congressman Blumenauer. Could I ask you one question before you jump to a vote?
Okay, quickly.
Oh, quickly, I just want to ask for everyone on the line today how they can help support your efforts. What can they do to help advance the legislation that you referenced?
Well, we are eagerly seeking co-sponsors of the legislation. We want more people to be engaged in these conversations at home. We're trying to build the coalition of all the people who are connected in the field of neuroscience. There are, as I mentioned, 88 organizations that have engaged in support, but we need to move beyond people who sign up, people who co-sponsor. We need people to make this a priority. We have seen tremendous progress in medical developments in terms of what's happened with cardiology, what's happened with cancer. There have been amazing breakthroughs, and that's the only way to describe them, breakthroughs. We've had a great deal of promising research in neuroscience, but to date we haven't had the breakthroughs that we've seen in those other areas. And I'm hopeful that people will be able to enlist their efforts to try and raise our sights, because it's past time to have the breakthroughs that will transform lives of Americans all across the country. I appreciate that question and appreciate working with you all to achieve this progress.
Thank you, Congressman. We appreciate your leadership very much.
You bet.
Okay, all right. So I'm now going to introduce Carrie Collins with the United States Brain Injury Alliance. There she is. Thank you, Carrie.
Good afternoon. I'm on the board of directors, chair-elect, and also public policy chair for the United States Brain Injury Alliance. I'm here to introduce Congressman Bacon from Nebraska. He has served as a member of the United States House of Representatives since 2017. He retired from the U.S. Air Force in 2014. He is a member of the House Armed Services Committee, and he's also co-chair of the Congressional Brain Injury Task Force. As co-chair, he has supported increased funding for the TBI Act programs and funding also for the Department of Defense, allowing for better identification and treatment of our wounded warriors with TBI. On behalf of the Brain Injury Alliance of Nebraska, the Congressman's home state, and the entire brain injury community, we would like to thank him for his hard work. Please join us now for a special video message from the Congressman.
Hi, I'm Congressman Don Bacon from Nebraska's 2nd District. Thank you all for joining us today for Brain Injury Awareness Day. I spent 29 years in the United States Air Force and retired as a Brigadier General. I saw firsthand how TBI impacts all Americans, including our servicemen and women. That is one of the many reasons I'm honored to serve as a co-chair of the Congressional Brain Injury Task Force. I would like to personally thank my friend and co-chair, Congressman Pascrell, for his hard work and dedication to this task force. I look forward to working alongside him and continue to bring more awareness to brain injuries. TBI affects all segments of our society. It is easy to think of TBI as just an injury for professional athletes or other physical occupations, but TBI can result from a range of incidents including motor vehicle accidents, physical violence, recreational activities, and even simple falls. In the United States, 4.8 million people are evaluated in emergency departments for TBI each year. And in 2017, 2.5 million U.S. high school students reported experiencing at least one concussion. In Nebraska, more than 10,000 people of all ages are diagnosed with TBI each year, but many go undiagnosed and untreated. Rural populations have higher incidence of TBI and they have poor outcomes and often experience longer times to reach care. Those who live with long-term consequences from TBI may require accommodations to simply live in society successfully. A significant brain injury sustained by one family member can cause emotional, physical, and often financial disruptions to the family system. It is estimated that with more than 2 million TBIs a year in the United States, the lifetime cost could be as much as $750 billion. Individual, family, community, and societal costs from TBI are too high, way too high. As I said earlier, the TBIs affecting our service members and veterans is particularly personal to me. Since 2000, more than 439,000 service members have been diagnosed with TBI. Half of U.S. Army soldiers report experiencing a TBI prior to enlistment, and 1 in 5 reports experience a TBI during their active duty. TBIs are associated with adverse mental health outcomes, including post-traumatic stress, anxiety, depression, and suicide. TBIs are an opponent just as dangerous as an enemy on the battlefield. It is our job to make sure our people are equipped to handle any foe, and this one's no different. I am glad to share that through the combined efforts of the Brain Injury Task Force, we were able to secure an additional $175 million in TBI and mental health research in the fiscal year 2022. And there was $5 million for wearable medical devices for TBI prevention. We are particularly grateful of the work of the Department of Defense and what it's done on obtaining FDA approval for portable TBI diagnostic tool and blood-based biomarkers to support TBI identification and care. With strong funding, we must now turn our attention to defining our goals and achieving real results. As the Republican lead on the BRAIN Act of 2021, I have pushed for an establishment of a Neuroscience Center of Excellence at the FDA. The Center of Excellence, if established, will help improve guidance, regulations, and research surrounding conditions impacting the brain. I was an original co-sponsor of Congressman Pascrell's TBI and PTSD Law Enforcement Training Act to establish crisis intervention training tools for first responders to address individuals with traumatic brain injuries. Finally, I was an early co-sponsor of the Veterans National Traumatic Brain Injury Treatment Act to start a 5-year pilot program so that veterans with TBI and PTSD would be treated with hyperbaric oxygen therapy so they could potentially live a better life. Our veterans deserve every chance at a better life. We have come far, but there's still more work to do. The United States lacks a comprehensive framework for addressing TBI. Too often, cases of TBI go undiagnosed or misdiagnosed or untreated. Most of the general public is unaware of TBI symptoms and does not know how to respond properly or treat them. We need to ensure adequate access to TBI programs and help after diagnosis, and we need to be more educated on TBI symptoms and causes. The nation needs, but lacks, the leadership to provide a focus for innovation and improvement in TBI care and research. Those here today can be that leadership. Thank you. Thank you for your time, and thank you for your combined efforts to make a difference in traumatic brain injury.
Thank you so much, Congressman Bacon, and to Matthew. We are so grateful for your leadership and your ongoing support for both civilian and military programs that support people living with the impacts of brain injury. We are now going to hear a video from Congressman Fred Keller, who is a member of Congress that represents Central Pennsylvania. Congressman Keller is in his second term of Congress and serves on the House Education and Workforce Committee. Through that committee work, the community was able to partner with Congressman Keller 2 years ago to raise the visibility and resources related to brain injury in the Older Americans Act reauthorization, which I think he'll talk a bit about. Congressman Keller does have a personal experience with brain injury, and we are grateful that he provided a video today.
Thank you for the outstanding work that is done by the Congressional Brain Injury Task Force. In 2019, the reports show that there were 61,000 traumatic brain injury deaths. That is far too many. I'm really pleased as a member of the House Education and Labor Committee that we could work on this issue and come up with some solutions. We offered an amendment in 2019 to the Older Americans Act that allowed for some funding so that screenings could be included when a senior citizen has a fall. That amendment was included in the final passage of the bill. It is really a good starting point that we can be having this funding and this awareness, but we need to continue to work on the education so that we can continue the good work, the outstanding work that you've been doing all along, and helping make more people aware of how we can save lives through education, research, and additional funding.
Okay, excellent. Thank you, Congressman Keller and his team that helped help us make that video a reality today. He's been a wonderful champion for us on Capitol Hill over the last 4 years. Next, we're going to be hearing from Congressman Mark Wayne Mullin of Oklahoma. Congressman Mullin was first elected to serve Oklahoma's 2nd Congressional District in November of 2012. He's currently serving his 5th term of Congress. And Congressman Mullin serves on the Energy and Commerce Committee, including the Subcommittee on Health, which our TBI Act reauthorization goes through for jurisdictional purposes. The Congressman is the co-chair of the Foster Youth Caucus, as well as the Alzheimer's Caucus. He also has a personal connection to brain injury and experienced difficulty finding rehabilitative services, which we will also hear about. So right now we'll hear from Congressman Mullin.
Hey everybody, I'm Congressman Mark Wayne Mullin, and I'm here to visit with you a little bit about our story and how we got involved with brain injuries. You know, I grew up competing my whole life, wrestling competitively for 16, 17 years, and I fought professionally for years, and you know, obviously played football and everything else. And you know, I just, you know, concussion was getting your bell rung, and you just kind of went on, and you didn't really give it a whole lot of thought. In fact, I remember when the NFL started talking about all these concussions and the ramifications of it, I just thought, well, whatever, man. I've had so many concussions, I can't even count. I mean, I got my bell rung, and you just kind of shake it off and go. I remember being in a fog for months one time, and when that fog lifted, I remember how much better I felt, but I thought it was just a fog. I didn't really recognize it as being a brain injury. And that all changed in January 17th of 2020. My son, Jim, who had been wrestling competitively since he was 4 years old, and he wasn't just your average wrestler. He was very good. He was ranked first or second in the nation at most weeks. He had wrestled all over the world for the junior world team, for USA's junior world team. He was highly recruited all over the country by just about every college out there. And we'd been having issues with him. In fact, we'd had him to the Cleveland Clinic. We'd had him to a concussion specialist. The Cleveland Clinic did 2 weeks of studies on him because what was happening is he kept passing out. And in the middle of a match, sometimes he would go out. His eyes would roll in the back of his head, and he would start flickering like this, and he'd come to, and he'd be fine, and no one could figure out what was happening. He wasn't hitting his head. He wasn't doing anything like that. It wasn't anything that you saw, a direct hit that would make you think that he was doing anything that was causing a concussion. And then January 2020, January 17th of 2020, that all changed. He's wrestling in Newton, Kansas, and he gets hit in the head again. But it wasn't a bad hit, but it was bad enough where they collided like this, and I saw him step back, and it was like slow motion to me. I knew something was wrong, but I wasn't for sure what it was, almost to the point where I was about ready to call the match. And when I did, the wrestler that he was wrestling again, he shot in again, and this time they hit heads hard. And Jim went flat back on his back. And the ref wasn't paying attention. Jim obviously was out. And they come over there and they slap the mat and pin him. And I get up, and then Jim gets up. But you could tell he was out or something, because his body went limp. And Jim gets up and he looks at me, and you could tell something's not right there. And he walks over to me and he says, "Dad, I don't feel good." And he collapses. And when he collapses, the trainer came running over there, and they couldn't get a pulse on him. And she started getting pretty excited. Of course, everybody started getting pretty excited. They started working on him real quick. They started getting a light pulse back on him. They rushed him to Wesley Medical Center in Wichita, Kansas, and they transferred him to they stabilized him, transferred him to the ICU room, pediatric ICU room, and he had no stimulation. They were working on him, trying to get him, trying to get any type of movement out of him, any type of activity. His heart rate stayed at about 48 beats a minute. Sometimes it would go to 52. Now, he was a real good athlete, so that's not unusual for the low heart rate at a resting athlete, but it was unusual that there was no stimulation to him. I mean, they were poking him and prodding him. They were rubbed his chest, his sternum raw. They put all this stuff in his hair, rolling him over. Nothing. He didn't respond to anything. And then about 16 hours later, he woke up, and he just kind of woke up, and he looked at me and he says, "Hey, Dad." And I was like, "Welcome back, son." And we started talking for a little bit, and he was normal. I mean, just talking to me like normal. And I buzzed the nurses, and they came in there, and they started checking him, and his heart rate went back up, and they checked his vitals, and then asked him if he wanted something to eat, and they said yes. And so he started eating something, and he took about 2 bites, and he looked at me, and he said, "Dad, help me." And he screamed. I've never heard that boy scream, and he screamed. Eyes roll in the back of his head. He goes completely stiff, and he's out. And he was out for 9 hours. And then when he came back to the second time, he didn't know anything. He didn't know who I was, didn't know who my wife was, didn't know what year it was, what his age was. He didn't know anything. And they came in there and started testing him. And here's this kid is a big athlete, and he can't touch his nose. He couldn't take his right hand to his nose. He couldn't take his left hand to his nose. He most definitely couldn't do them both at the same time. He couldn't lift both his legs up at the same time. He could move one at a time, but he couldn't lift them, swing them up out of the bed. When he went to walk, he was, they were literally having to hold on to him with a safety belt, and he was shuffling his feet. And this is a kid that the day before could do a round off full and not even think about it. He's very athletic. man, I was at loss. I didn't know what to do. And the neurologist came in, the pediatric neurologist came in. This is the second time we saw a different neurologist while we were at the hospital, and he had no answers. And he said, oh, I believe it's going to wear off. I believe it's going to wear off. I believe if you just go on, it'll wear off. But I was like, so you want us to go home? You just want us to go home. You're done, and that's it. That's your story. You want us to go home. They said, well, we don't really have any answers. We really, there's some rehabilitation that we'll find for you in the Tulsa area, since that's where you're from. But we think that's what's going to happen. We think in a few days this will wear off. And I was like, no, you don't understand this. This is a kid that was a little bit of a world-class athlete that he can't touch his nose, and that's your answer. And about that time, a guy called me, a good friend of mine named Kevin McCarthy. He's Leader McCarthy. He says, he wanted to check and see how we're doing, because somehow this thing broke and it was all over the news about my son getting hurt. And I still don't know how that happened. And he introduced me to a guy named Mark Ashley. Dr. Mark Ashley was Center for Neural Skills in Bakersfield, California. Of course, they have other locations, but Mark was there. Mark started asking me questions. Now, mind you, we've been dealing with this, but we didn't know it was concussions. We didn't know what was going on, but we've been dealing with issues with him for almost 2 years. And no one, we talked to, I don't know how many different neurologists, spent thousands, actually well over $100,000 and medical bills. And no one could give us an answer of what was happening. And I finally was talking to Mark Ashley, and for the first time, he started asking me questions. And he said, Mark Wayne, we can help. And when he was asking me the questions, I was like, yeah, that's what's happening. Yeah, that's what's happening. Well, Mark, when did this happen first? Yeah, that's what happened. I felt good, even though I was tore up and I've been crying, I've been crying so much at this point. I was emotionally drained. I felt hope for the first time. For the first time, I felt like somebody actually understands what's going on with our son. And especially now. And he says, we need him in Bakersfield. We need him in Bakersfield. We can help, but we need him in Bakersfield. I was like, no problem. We'll fly there. And he's like, no, you can't fly. You can drive. And that was the first time I was actually happy we had the motor coach. And so we flew to Bakersfield, and they did a week of testing on him. And the more they tested, the more painful it got for me. I mean, I was just tore up as a dad. I was just trashed inside. But I had hope because they were testing and writing it down and understood the little holes that he was missing. And of course, Jim had short-term memory loss and long-term memory loss. And at the end of the whole week, Dr. Mark Ashley and his team of outstanding professionals, one by one, came in and talked to Christy, and I had Jim there, and myself, and explaining to us what was going on. But at the end of it, they said, all this stuff can be fixed, but it's going to be tough. And it's going to take a while. We figure this will take between 2 and 3 years of rehab if you guys are willing to do it. And I said, sir, we don't quit isn't in our family. We don't know how to handle it any other way. And we walked out, and it was tough. I mean, here the kid was doing trig in high school, and he couldn't do 5+3 now. He was a kid that was wanting to be an engineer, and he was reading on a third grade learning level. I mean, and he had his penmanship was worse than the kindergarten. I mean, he had no control. He couldn't even put a small puzzle together. I mean, I remember watching him struggle putting a kindergarten puzzle together, and he couldn't do it. And for me, how hard that was as a kid, as a father, it destroyed me. I mean, literally destroyed me inside. I was speechless for words, and how hard that was. But for Jim, when we walked outside, I asked him, I said, Jim, what do you think? And he looked at me, and he was 15. He was 15 years old at that time. He's 17 now. He looked at me, he says, Dad, I've learned it once, I'll learn it again. And that was his attitude. That was his attitude. And now that we felt blessed. I mean, my son was walking and he could communicate. There was a lot of people at the Center for Neural Skills that was in a lot worse shape than we were. So we felt blessed every single day we got there. But to see the team that at the Center for Neural Skills adjust and put a schedule together, and put rehabs together, and put the rehab in each area, each professor, as I like to say, but the professionals that was in those areas of rehabilitation, from the cognitive side to the education side, to seeing his psychiatrist, and to the physical therapy. everyone that we worked with, they were doing different programs for Jim because there were some very severe cases there. And even though we thought Jim was severe, we didn't realize how severe it was until we sent to the Center for Neuro Skills. And I'm dealing and talking with the parents. And then when we started seeing them really adjust their program towards Jim's style. I mean, Jim is one of those kids, as I said, you can't push him hard enough. And the more of a challenge you give him, the harder he tries. Quitting isn't part of his way of thinking. And to really see them get in and then start seeing them pair him with other kids. There was another kid there, and I won't mention his real name, but we'll call him Zach. To see this other wrestler that was there that was in a tragic car accident that was refusing to walk, but because he had lost his lower part of his leg, but he was refusing to walk. And even though he had some brain injury issues, this kid was still a wrestling champion from the state of California, and we were from Oklahoma. And to see them pair Jim and him together, and then I got to know the mom very well. In fact, I still stay in contact with the mom regularly. And to see Zach, as I'm saying, I'm not using his real name, but to see Zach react, because you've seen two athletes that came from a same background that were self-motivated, to see Jim and him start reacting together and see Zach put on his leg finally and start pushing himself and start working out and start really changing the way he's doing and what he's doing around him, and to see that the Center for Neuro Skills adopted their programs towards that. And the whole time they're like, we're going to get Jim and these other students to their best ability. We're going to bring them back. We're going to break them simply down, and then we're going to bring them back. We're going to rehabilitate the brain. Man, I had not a clue about Center for Neuro Skills, and to see these other parents say they've had this similar journey. They've met with all these neurologists, and you meet with 12 neurologists, especially pediatric neurologists. You'll get 12 different answers. Even if you get an answer, sometimes you don't even get an answer, and it's not their fault. It's just that's how much we don't know about brain injuries. And that's why this week is so important. That's why when we talk and we meet and we have these meetings like this, and we come together and start planning the future, from the funding to the professional side of it. We have to start bringing all those skills together, because parents like us that was lost for 2 years trying to find an answer, and it had to compound to the point where we almost lost our son. If we wouldn't have been there, we would have lost him, because he ended up coding 3 times, and we almost lost him 3 different times. If we would have had answers before then, maybe we wouldn't have came to that point. But there's no point in looking back, because what led us was to a passion. It changed Jim's life for the rest of his life. He's had to adapt to new things, but he's to his best ability, and it's a blessing to see it. So we have to do better. And those of us that's passionate about this, and those of us that are interested in this, we have to do better working together. And that's working with the universities, through medical school, to working with professionals once they get into that field, to working with Congress to make sure we have the funding. And so when you see me, know you have an advocate, truly a strong advocate in this field, that's going to do everything we can to help advocate for brain injuries. But I need your guys' help, because I'm not a professional in it. I need you guys to educate us. So thank you for giving me this time. I know I probably went a little long, but I'm very passionate about this. So anything I can do for you all, please let me know. May God bless you. And as always, may God bless the United States of America.
Well, that was an incredible story. Thank you, Congressman Mullin, for sharing that video, and to your team for helping you put the video together. Truly impactful. We will next hear from a good friend of the community's, Dr. Matt Breeding from the CDC. Most of you know, but Dr. Breeding is a behavioral scientist and serves as the team lead of the traumatic brain injury team in the Division of Injury Prevention at the CDC's Injury Center. His work at the CDC has been focused on surveillance of traumatic brain injury, intimate partner violence, sexual violence, and child abuse, both domestic and international. We are so grateful for all that you do on behalf of individuals with brain injury, and thank you for joining us today.
Good afternoon. It's a pleasure to be speaking at this event, raising awareness about the impact of brain injuries within our communities and in our nation. My name is Matt Breiting, and I'm a behavioral scientist. I'm a traumatic brain injury team lead at the Centers for Disease Control and Prevention. I want to start by thanking the Congressional Brain Injury Task Force, BIAA, and NASHIA for sponsoring this great event. I'd also like to acknowledge the critical leadership of Congressman Pascrell and Bacon. Brain Injury Awareness Day really gives us a chance to reflect each year about the progress we've made in our brain injury prevention efforts, and also to be responsive to those who are living with the consequences of a brain injury. We know traumatic brain injuries, or TBIs, are a significant public health concern in the United States. However, existing national estimates of TBI are likely a considerable underestimate of the overall TBI burden. Current estimates only capture emergency department visits and hospitalizations that are identified as TBI related. But a recent study in a pediatric healthcare system found that nearly 80% of evaluated concussions were treated outside of that hospital setting. So given that many do not seek care for a TBI, this suggests that emergency department-based incidence estimates may fail to capture more than 80% of pediatric concussions. So in order to address the gaps in TBI surveillance, CDC piloted a national concussion surveillance system. We did this using a random digit dial telephone survey of US households. And I'm really excited today to share some of the preliminary findings for the very first time. So just to give some context, these preliminary results don't provide national prevalence estimates of TBI, but do provide findings from over 10,000 adults across the United States who served as survey respondents. And they also provided information on over 3,500 children living in their respective households. So additional context for the preliminary findings presented today, a head injury was classified as a TBI if a respondent reported that they had experienced a hit to the head plus at least one TBI sign or symptom. For example, loss of consciousness or nausea or vomiting, dizziness, being dazed or confused, those kinds of things. And so the results we found were that approximately 1 in 8 adults reported experiencing a TBI in the preceding 12 months. Approximately 1 in 10 children and adolescents, as reported by an adult in their household, experienced a TBI in the 12 months preceding the survey. As far as the leading causes of TBI, more than 65% of TBIs among children and adolescents occurred while engaged in sports or recreation-related activities. And then among adults, falls and being unintentionally struck by or against an object were the leading causes of TBI among adults. In terms of healthcare sought and received, approximately 40% of adults and 60% of children with a TBI were evaluated for their injury. So that suggests that many continue to not seek care after a TBI. And the primary reason that respondents gave for not seeking care after a TBI was that they did not believe their injury was serious enough. So this pilot was successful in documenting additional TBIs that are not accounted for through our current emergency department care-based estimates. So adult respondents reported more than 30 times as many TBIs in the past 12 months compared to the estimates that we have published using emergency department data from national data sets. And children and adolescents reported approximately 17 times as many TBIs in the past 12 months compared to estimates that are based on emergency department visits. So an ongoing national concussion surveillance, we believe, would provide the first ever truly comprehensive national estimates of TBI in the United States. In addition, it would allow us to identify trends and populations at higher risk, and it would provide us critical information about the effectiveness of prevention efforts. A fully supported system would also make it possible to provide state-level estimates. So Thus far, I've focused on our work to quantify the burden of TBI in the United States. And now I'd like to switch gears just a little bit to talk about CDC's efforts to reduce the public health burden of TBI. CDC's Heads Up trainings have helped many parents, coaches, school staff, and healthcare providers to recognize, respond to, and minimize the risk of concussion and other serious brain injury. Heads Up trainings have been completed by more than 10 million people over the last decade. And this includes our Heads Up to Youth Sports training and our Heads Up to Healthcare Providers training. But as CDC Heads Up approaches its 20th anniversary next year, we are pushing to improve the campaign's ability to reach a broader group of individuals with concussion safety information. So last year, we released a new training, the Heads Up to Schools online concussion training for school professionals. This was created to help educate classroom teachers, school administrators, and other staff who work with students about how to identify and monitor signs and symptoms of concussion, as well as how to help students successfully recover from a concussion and return to school safely. Today, we're announcing the release of another new training titled Heads Up to Athletic Trainers. This new interactive training was specifically designed to empower athletic trainers in their unique role regarding concussion prevention and management. It includes tips ranging from how to best implement safety and response plans to how to conduct ongoing concussion care and stakeholder education. This training was created in collaboration with experts from the National Athletic Trainers Association, or NATA, and it's now available online through the CDC Heads Up website. So in closing, I want to thank you for the important role you play in ensuring those who have experienced a brain injury have the knowledge, resources, care, and support they need to truly live well. Your support of CDC is greatly appreciated. CDC is proud to be a part of this community and the role we serve. I look forward to updating you again next year on the progress we're making. Thank you.
Thank you, Matt. Do you mind staying on for a couple moments for some dialogue? I think it's so exciting to see the progress being made with the National Concussion Surveillance System and your leadership. Truly, it wouldn't happen without. You've been coming to Brain Injury Awareness Day every year for the last several years, talking about the importance of this data, and it really feels as though we're finally, getting so close to being able to launch. And so I'm just curious if you're able to share with funding coming from Congress for the concussion surveillance system, has there been a plan developed yet on how to action it, or are those plans still being worked out?
Yeah, so we have been thinking about a plan since we collected the data and have been analyzing the data. We reported some of the preliminary findings today, but that work is really ongoing. But based on those preliminary findings, we think that probably the best way to capture truly comprehensive estimates is to conduct some type of a household survey. Now, there's a number of different ways to collect that information. One of which was through a telephone survey. Now, the response rates for telephone surveys have declined in recent years, and so that has led us to think about other ways of collecting household survey data. And so there's a number of different options available for that. So, I think there's a couple of different ways we could go. What we've talked about with, it depends on the funding level, but our optimal method would be to collect a national survey, and it would primarily be through what's called address-based sampling, and it would be sending U.S. mail to a random selection of U.S. households and allowing for respondents to respond to the survey in a number of different modalities. One being a web survey, one being a paper and pencil questionnaire they would mail back. Another would be for them to call in to a call center and provide that information. So that is, I think, the methodology we would prefer to move forward with. But it's, very new and exciting news about the additional funding, and so we've been thinking about that even more since that time, and talking about what we can do with that. So we're very excited about it, and thank you for all of your help in making that happen.
Absolutely, it is very exciting. So how does that compare to some of the other surveillance systems that CDC runs? I think, we hear about different projects at different surveillance systems at the CDC, and because we've been so focused on this one, I'm not sure, that we fully understand how they compare to one another. So just, if you wouldn't mind shedding some light on sort of, how that looks big picture, that might be helpful context.
Sure. So if you're talking about like the full range of health conditions that CDC collects information on, there are many ways of capturing that information. One of which is the use of administrative healthcare data sets that have allowed us to produce estimates of the number of TBI-related hospitalizations and emergency department visits. So that's a fairly common way to collect that information. Many other health conditions collect their surveillance data from different types of surveys, such as the Youth Risk Behavior Survey, which collects paper and pencil questionnaires from a national sample of US high school students. There's a number of telephone-based surveys, although they're also having to evaluate what they should do with declining response rates. The National Health Interview Survey conducts most of their interviews in person through a random sample of US households. And a number of other have been moving toward this address-based sampling methodology. Some of the other groups we've talked to at CDC have found that it's obtains a better response rate than the telephone surveys, which is what we used in the National Concussion Surveillance System pilot. So we think that will help with getting a better representative sample of the United States.
That makes sense. Are there other surveys that you administer that there are brain injury related questions on? I know you mentioned the youth survey. Are there others as well that we should be aware of?
Yeah, so the one that I mentioned previously, the YRBS, and I think Representative Bacon quoted some numbers on that, on the 2.5 million high school students each year who have self-reported having experienced a sports-related concussion in the past year. So that's one of the ways. We have not collected any type of national level surveillance ourselves using that methodology, other than through the National Concussion Surveillance System pilot. We have used different surveys for research studies, and so we're familiar with that, but this is really kind of new to be able to collect this information, surveillance information through a survey.
Well, we are very excited again about all the work that you're doing, and that there are some resources behind the new surveillance system. We'll continue as a community to support your work, and just appreciate your ongoing partnership. You really have been. CDC's been such a wonderful partner, so thank you. We appreciate everything you're doing.
Same to you. Thank you.
Thank you. All right, wonderful. Well, I now am going to ask my friend Michael Gamble McCormick to come. Here he is. Hi, Michael. Thank you so much for joining us today. I'm going to just read a brief bio of you quickly and allow you to jump in. But for those of you who have not met Michael, Michael is the Disability Policy Director for the Senate Special Committee on Aging, which is chaired by Senator Bob Casey from Pennsylvania. Senator Casey, staffed by Michael, is the lead sponsor of the TBI authorization, and also sponsors a number of bills that support the needs of individuals with disabilities, including the Better Care, Better Jobs Act, other bills to support home and community-based service funding, the Transformation to Competitive and Integrated Employment Act, and support for the direct care workforce. I could go on, but truly, those of you who have met Michael know the disability community has an advocate with him and Senator Casey, and we are just very grateful for your time today to give us an update, Michael, on some of the moving policies that we and the brain injury community will benefit from. Oh, I think you might be on mute.
I am muted, or I was. Thanks for the introduction, Becky, and it's good to see you. And great wishes to everybody who's out there. And Senator Casey sends his wishes as well. So I wanted to update you on a couple of things, not the least of which I will start with is the Able Age Adjustment Act. One of the things that Senator Casey is extraordinarily concerned about, but also I think has done some real just groundbreaking work on, is the fact that some of our federal policies really inhibit people with disabilities to return to work and to earn a living and to have the flexibility to manage their funds. So back in 2014, he was the Senate lead on passing ABLE accounts, and ABLE accounts allow somebody who receives federal disability benefits to also be able to exceed the asset limits that are often connected to those benefits and to save for the future, to save for assistive technology or to go back to school or to start a business or any number of things that could be related to making sure that people are in financially healthy situations. But the problem with the ABLE Act back in 2014 was that it only allows for people who acquire their disability prior to 26 years of age to open one. So that means that anybody who's older than 26 can't open an account and is not able to invest in savings so that to prepare for emergencies or other types of things in the future. So Able Age Adjustment has been introduced for the last 3 Congresses. The Senator is really proud that this Congress, we truly have a bipartisan effort there. I think there are currently 13 co-sponsors, 5 of them are Republican, and 8 of them are Democrats. And it's we hope this year is the year that we're able to pass it so that individuals up to 46 years of age will be able to open an ABLE account. And that means that a lot of people who end up acquiring the disability and especially a TBI or an ABI will be able to open accounts. The expansion of that age period will mean that there's 6 million more people eligible, and approximately 1 million of those are veterans as well. So we want to make sure that those individuals have access to that, to those accounts. An accompanying piece of policy that I just want to talk about that we're not nearly quite as far along on, but also causes a lot of limitations for people who have acquired a disability and want to go back to work, is what's called the substantial gainful activity limit. And that means that not only can't you have savings over $2,000 if you're receiving federal disability benefits, but it also means you can't earn more than a certain amount each month. And this year in 2022, that amount is about $1,350. That limitation is huge, particularly as we see wages, hourly wages increasing as we've seen through the pandemic, that employers are looking hard for employees. The good news about disability employment is that despite it being dreadfully low, it is at the highest rate that it's been since we've kept track of it. It is higher than 4 years ago. It is higher than even in 2008 when we first started keeping those statistics. But as wages rise, as hourly wages rise into $12, $14, $15 an hour, and even at a starting rate, it means that if someone is working full time and they can only work approximately 2 weeks and a day each month, and then they will exceed the substantial gainful activity limit, and that could mean that they begin to lose their disability benefits. So with Senator Brown's office, Senator Hassan's office, a couple other offices, Senator Casey's working on looking at increasing that limitation as well. And then I'll spend just a little bit of time telling you about some of the home care and community care efforts that Senator Casey's been working on. He's been a champion in this area for many, many years. Just prior to the pandemic, he had finished a bill to try to expand home and community-based services that got introduced in February of 2020. And then we went into lockdown, and it also meant that we needed to go into overdrive to address those concerns as well, because if any of you are working with somebody who needs home care services or community care supports, you know how hard it is to find the workforce. There are vacancy rates that are running somewhere between 20 and 40 or 45%, depending on what your community is. And the turnover rates can be as high as 60, 70, 80% annually for the workforce. Part of that is because of the lowering unemployment rate, and there are fewer people around to do that work. But part of it also is that this is very, very demanding work. It's work that is essential. It helps people stay independent. It helps them stay in their own homes to live more independently and connect to the folks that they want to be connected to. But finding that workforce is really hard. So Senator Casey has been working very hard to get past a piece of legislation that would put about $150 billion into that workforce to both expand services, but also to increase compensation, because despite the fact that in many, many cases, direct care workers are working in situations where they have really wonderful relationships with the people they're supporting. The cost of living and the demands on families right now are quite high. So we need to see good compensation for this workforce. And Becky mentioned what is called the Better Care, Better Jobs Act. It's Senate Bill 2210. And that is exactly what we're working on now. You're the first group that I'm going to say this to, but next week he will have a hearing in the Special Committee on Aging on Home and Community-Based Services. That hearing was just announced today, and it will highlight both those who have disabilities in their young and middle adulthoods, as well as those who need home care supports as they age as well. So those are three of the big pieces that the senator has been working on. I'm going to stop there. Becky, I know that you've got a stop time in just a few minutes. I don't know if there's a question or a comment that anybody wants to make, but thanks for the opportunity to share some of this information.
Well, thank you for sharing it. I think sometimes we don't know all of the activity that's happening. And so just hearing in 10 minutes all of these initiatives that you're leading is really inspiring. And so I think my question for you is, how can we help support the senator and these initiatives? We're so fortunate to have champions like Senator Casey, but what can we do to support your efforts?
Yeah, I think the most important thing for him and for the policies in general is just a bipartisan effort where, and if the people listening have contacts with their senators, both Republican and Democrat, it's really to reach out and ask them to co-sponsor these efforts. The Able Age Adjustment Act is a great example of that. Senator Moran is the Republican lead on that particular piece of legislation with Senator Casey. They really, in many cases, they don't see eye to eye on certain policies, but here there's just no daylight between them. They absolutely see the importance of making sure that we can get the type of statutes in place that support people to save and to work. And to actually make their families healthier. So the simplest thing is really to reach out to your senators, and also in the case where a bill is in the House of Representatives, your congresswoman or congressman as well, and just offer the support. And if they're not supporting, ask them to sign on and support.
Wonderful, thank you. Well, we are in the middle of Brain Injury Awareness Day congressional activities. We've had over 50 visits this week, and so we will make sure to add those to our talking points for sure. But thank you, Michael. We really appreciate your time and you joining us today.
No, it's good to see you, and my best to everybody as you do your advocacy. Take care.
Thanks, Michael. All right, well, I am very pleased to turn the mic over now to Ms. Susan Connors. Susan, take it away. Thank you.
Hi, Becky. Thanks very much. And thanks to everybody who joined in today. I'm Susan Connors. I'm the president and CEO of the Brain Injury Association of America. The first thing I want to say is I know that anybody who saw President Zelensky or who watches the news at all joins me in saying that our hearts and minds are absolutely with the people of Ukraine. Seeing that devastation, war is hell, and it causes brain injury, and I know that all of us care about what's happening over there. Next, I want to thank Congressman Pascrell, Congressman Bacon, their staff, Matthew and Carrie, and all of today's speakers, including our moderators, for putting together this really wonderful briefing. I have spent many years, going on 20 now, complaining that we were spending our time talking to us. And it was, I was really, really excited to see the tables turned and to have the members of Congress and their staff talk to us and tell us what they are doing. I want to send a very special shout out to Becky and Susan at NASHA and to Stephanie at BIAA for really jumping in overtime to try to put this together. As you guys can imagine, with so much going on Capitol Hill, it's not easy to make 11th hour adjustments, and Carrie and Matthew and the team all did it, so hooray. We had more than 1,000 people register in advance for this briefing. We did make a recording of it, so those who were not able to get in for whatever reason will be able to see it after the fact. Many people, about 20%, more than 200 actually, submitted questions in advance of the briefing. We were not able to answer all of them. We really didn't know how our timing would work. And so we distributed the questions in advance, in particular to the U.S. Brain Injury Alliance, USBIA, and to BIAA. And hopefully those will be distributed out to the state brain injury organizations so that those who ask questions will get individual responses to them. The other thing is that about 25% of the questions that you all submitted were really medical in nature, and that has prompted the Brain Injury Association of America to think about how to start a monthly Facebook Live Ask the Doctor sessions. So we will be inviting various volunteers to come online with our own Greg Ayotte. Many of you all know Greg, and to do an Ask the Doctor session once a month so that you can get your questions answered. In the meantime, we could really use your help in advocating for our shared policy priorities. Today, we heard about the Congressional Brain Injury Task Force and the need to encourage more people to join the task force. And we heard about the importance of appropriations for fiscal year 2023, which seems hard to believe that they'll be just starting working on that, but it's about to start. And specifically, we're looking for $25 million for the Administration on Community Living for the TBI program there. And we're looking for $11.7 million for CDC, which would include $5 million for the concussion surveillance system that Matt talked about. You all heard about the BRAIN Act to create a neuroscience center of excellence at the FDA. You also heard about Congressman Pascrell and Congressman Bacon's TBI and PTSD Law Enforcement Training Act. Finally, Senator Casey's staff talked about the Able Age Adjustment Act and the Better Care, Better Jobs Act. And I'm going to mention one other piece of legislation that the Brain Injury Association is supporting from Jan Shinkowski's office, which is the End Mandatory Medicaid Estate Recovery. That's for families who have relied end of life for a loved one on Medicaid, and in many states, Medicaid is required to go and recover what was spent for that end-of-life care, and that often means that a family has to sell their home or whatever other items of value in order to recover, and we'd like to see that stop. All of these things are going to be made easier for you all to advocate with with the Brain Injury Association's new Legislative Action Center. Immediately following this presentation, you all are going to get a link to this website right here. And you will be able to go in, sign up, your first name, your last name, your address, so that it knows what congressional district you are in. And it will help you, without any other effort whatsoever, reach out to Congress, your members of Congress, your 2 senators, and your representative about each one of these issues. We're going to start with the Congressional Brain Injury Task Force, asking you to thank your member of Congress if he or she has already joined the task force, and if not, to ask them to do so. And the system will automatically know who's on the task force already and who still needs to be prompted to join. After that request, after that action, we'll start working on the other actions, the appropriations requests, the BRAIN Act, the TBI and PTSD Law Enforcement Training Act, the Age Able Adjustment Act, the Better Care, Better Jobs Act, eventually even the ending mandatory Medicaid estate recovery. Each one of these things, without having to know too much about the minute details of the legislation, you will, as advocates, as grassroots advocates, be able to go in and very simply make your support known to your members of Congress. And then the last thing that I want to say is that over the last 20 years, participation in Brain Injury Awareness Day has grown and grown and grown and grown and grown. And it is very gratifying to see how many people have engaged and how many members of Congress are aware of our issues and care about our issues. The story from Markwayne Mullin was hugely compelling. And what it tells me is that he gets it, that he understands where many of you all have been. And so, as he said, you have an advocate. So let's make sure we use it. Let's make sure that we take advantage of all of the members of Congress who are increasingly aware of brain injury and who want to do something to help us. And with that, I thank you for attending today's sessions. And I urge you to tuck away just a little bit of money, $10 a week, $20 a week, whatever you can afford, so that you can come to Washington this time next year to be here in person, because I am absolutely sure that next year Brain Injury Awareness Day will happen in person and not virtually. So I thank you all very much. Becky, do you want to join me in saying a few final words of goodbye?
Absolutely. No, thank you, Susan. It's been a real, we were in the trenches together, and it came together beautifully. It really was so wonderful to see so many members share their support. And I can guarantee you all that the BIAA and NASHA and USBIA will be working together to follow up with those offices and continue to utilize their advocacy. And I just wanted to also say thank you to Carrie and Matthew for all of your help and partnership throughout this process. It was a great day. So thank you. Thank you, Susan.
Thanks, everybody.
Have a great week. Bye.